worthwhile. We are happy to have Ken Spencer from HR Services Incorporated. This is an ERISA Solutions and ERISA Compliance partner of ours. Tell you a little bit about Ken's biograph, and we'll go from there. Ken has over 30 years of professional compliance and human resource management experience. He formed HR Services and HR Solutions in 2004, providing extensive compliance, ERISA, and HR solutions for clients and brokers across the country. Their services include ERISA solutions, compliance, employee notices, Section 125, pre-taxing documents, SPD wraps, and HR solutions for thousands of clients across the country. Ken taught compliance, leadership, and HR courses for 8 years at Westminster College and taught employment law at the University of Phoenix. He's earned a master's degree in human resource management from the University of Utah and holds bachelor degrees in marketing and finance. And Ken holds many certified degrees regarding and certifications regarding human resources and employee management. So Ken, I'll turn it over to you, and we'll hear about your program. Thanks.
Great. Hey, thanks, Brian, and thanks everyone for joining us here today. We're glad to have this discussion with you to help you be fully compliant with all the various compliance issues and challenges out there. It seems like it's an ever-changing event. There's always something going on with the Affordable Care Act or ERISA compliance and such. So we're going to talk today about some of the common problems that you're faced with, and then we'll also talk to you about some solutions and some techniques to help you to be compliant. So some of the main problems that you're faced with out there right now, many of you have probably heard that the Department of Labor is auditing more plans. So they're doing ERISA audits. ERISA is the Employee Retirement Income Security Act, and that's the act that governs all employee benefit programs, health and welfare plans, as well as retirement plans. And they've increased their auditors. They've hired additional auditors. They're auditing more plans. We had a 15-person company audited just a few months ago. We've had a 40-person company audited. We're hearing that they have plans of auditing all groups by 2018. So we're going to give you a little high-level view initially here of the kinds of things they look for in those audits. And then we'll talk to you about some other problems and some ways that we can help you prepare for these things. A very high-level view, when they're doing an audit, there's like a 4-page audit letter that comes out, and it would be sent to you notifying you of the audit. And the audit may come for various reasons. It may just be that your lucky number came up because, again, they're planning to audit everybody eventually. It could be that maybe there's a complaint about your benefit plan, or maybe they're auditing your retirement plan and they decide to audit your health and welfare plan at the same time. So lots of reasons why that may happen. But the things they look for, a very high-level view here, one of the first things they look for is what's called a summary plan description. And they want this for each of your benefit plans, medical, dental, life, disability, etc. Or they will also accept what's called a summary plan description wrap document. And what the summary plan description is it's the ERISA, they want to make sure all participants receive all these various details about the plans. What you get from the insurance company provides part of what makes up and constitutes a summary plan description. So the details, the coverage, the deductible, the limitations, all of that makes up part of a summary plan description, but it's missing parts. There's missing different things that ERISA says you should have, like eligibility, the rates, who to call when they have questions, details about each of the plans. So what a lot of companies will do is they'll use a summary plan description wrap document, or an SPD wrap. And that's also acceptable to the auditors. And what a wrap document does is it creates one overall plan document, one overall summary plan description, wrapping around all of the various benefit plans, medical, dental, life, disability, etc., pulling in the missing insurance company information, tying in the required ERISA language. So a lot of folks are using that, and that will meet the requirements. In fact, I've even heard some auditors that kind of prefer that because it simplifies their audit process. They're also looking for various notices, and I'm going to defer on going into detail on these notices here because I'll show you more. There's other notices they look for and others that apply based on the size of the group, based on how your benefits are set up. So we'll go through all of those here in just a moment. Of course, they're looking for various triggering event type notices, like a COBRA qualifying event notice when somebody loses coverage because of perhaps divorce or age, they've turned older than 26, or the more common one is they've left your company, and then they're eligible for COBRA. So we need to make sure that those are happening. And then they're checking for 5,500 reports. Those generally only apply if you have 100 or more participants on any given benefit plan, and in that plan you would submit in the Form 5500 on those. And interesting, they're checking on a lot of healthcare reform compliance items. And I suspect they're verifying that you're implementing them, that and this is probably a key driver for the audits and the pickup and the increase in audits. They want to make sure everyone's following the compliance, and they're perhaps looking to get a little revenue through some of the fines that they're assigning. But one of the next problems that's out there is making sure that you're getting all of the notices out to participants in the plan. So if you look at this big list here, you've got everything from COBRA, CHIP, mental health and parity, newborns, women's health and cancer, patient protection, HIPAA. There's two here that only apply if you have here's the wellness program. If you have a wellness program, then there's a wellness program notice. If you have a grandfather plan, then there's a grandfather plan notice. Most of the grandfather plans have kind of phased out now. There's not too many of those around. They've been somewhat priced out of the market. And then you've got all these others, GINA, FMLA, there's USERA, Medicare Part D, Health Exchange Notice. And by the way, the Health Exchange Notice should have gone out back in October of 2013 to all employees. That's the only notice on this whole list that goes to everyone. The others only apply to participants in the plan. So, but the Health Exchange Notice should have went out to everyone. If it didn't go out to everyone, you could still do that and get it out to everyone, but then you have to give it now to all new hires, whether they're a participant in the plan or not. And so, so we're going to show you some tools and resources to help you know what notice applies, how do you get them out, when do you send them out. It's kind of like I said, it's a challenge and a hassle to get all of these out. And so we'll show you a tool and a technique to help with that in just a moment. Now, another challenge that's out there is how do you keep current on all of the employment laws and all the changes, healthcare reform, ERISA, FMLA, Fair Labor Standards Act. There's always something going on and changing. And if it's not bad enough for the changing federal changes and issues, there's a lot of things going on state-by-state changes as well. And many of you have employees in more than one state, so you've got multiple states you have to keep up with. And so I'll show you a technique and a process and a way to keep current on all of these employment laws as well. The other challenge that's still out there in the market, a lot of organizations are not fully compliant with HIPAA. There's healthcare, or there's a number of changes, high-tech provision changes. Also, the way that they're managing what's called the PHI, Protected Health Information. And PHI is any information on employees that identifies their medical condition or their issues and then connects that to that individual by name or social security number or some other way that they're identified. That all of a sudden becomes protected information under HIPAA or PHI. And so there's a number of ways you need to make sure you're securing that data, whether it's electronically or physically on site, and how you're protecting and securing that information. You should also have business associate agreements with anyone who's helping or working with PHI for your organization. So we'll show you a toolkit that's available and a method to help make sure that you're compliant with HIPAA as well. Now, another issue that's going on is a lot of folks don't realize their 125 premium only plan documents or flexible spending account. If you have a full cafeteria plan, those documents are out of date. There were changes last year in definition of spouse. There were changes in eligibility related to the healthcare reform. And so there's a number of things that you either need to have those documents amended, or you may want to just replace them. So again, that's just something to think about, another challenge. Well, I'm going to take a few moments and show you a service that's available. So Brian and his team has sought us out, and we've made some arrangements with them to offer some solutions at some preferred pricing because of our relationship with them. This is a solution that's referred to as Compliance Basics Plus. And what this service will do is it'll address all of the problems that we just talked about and more. So I'll just briefly show that to you, and then of course we'll answer any questions that you have. The first thing that this service does is it provides you with what you need to know and do every month. So once a month, you're going to receive a legal alert that gives you key due date reminders, key actions, and federal and state employment laws, everything that's going on. So here's an example of one where it shows the key compliance reminders and actions at the front. It gives federal compliance changes, and then it also gives state-by-state changes. So you can go in here in this particular article in Virginia and West Virginia, there were no changes when this article went out. However, there were changes if you look at Vermont and Texas. So anything that's highlighted and underlined, if it's an area where you have employees, then you can go in there and click on that and see what's changed or see what actions you have. So it's just a very simple way to keep you informed, because if you're not keeping yourself informed and know the changes and know what's going on, how can you ever have a chance of being compliant? So this is the first part of this service. The next thing that this does for you is it provides you with, once a month, a best practice article. Usually it's either HR, compliance, or leadership related. And it gives you a tool that you can share either with others in your organization or perhaps just helping you to implement some change. Just for example, the first of the year we did an article on the employer reporting requirements in the healthcare reform. So anyone who has 50 or more employees, you now have to prepare now so that you can be able to report in January of 2016 all the requirements. So we've got that article that's that's out there. We've done articles on wellness plans. We've done articles on various HR topics and such. Here's an example of one that we did on how to pass and prepare for ERISA audits. And so and then we make all of these available for you inside the web-based tools, which I'll go in and show you in just a moment. Well, back to this big list of all of these employee notices that we were talking about a moment ago. We've created a web-based tool that within the system where if you go in and you answer some simple questions about your company and simple questions about your medical plan, we only ask the questions that are needed to help identify which notice applies or the information needed to populate the notice. So you go in, you answer these basic questions, and then you push a button that says Generate Employee Notices. Then our system automatically pulls in which notice applies, populates it or fills it out, and then emails it to you in a ready-to-deliver format. And you'll see when we go into that tool, it'll pull in your business logo, all the information about you. The notices are customized for you, and it's a very easy way to take care of your annual notices all in one shot. So we recommend you do this right around the same time you do your open enrollment each year. You know your new plan, you know any changes that's going on. You go into our web-based tool under Employee Notices, Employee Notice Report. You fill in any changes and press a button to generate your notice. You'll see when we go into this system here in just a second, it also has an option for a health exchange notice. We keep that one separate because that one, as I mentioned earlier, goes to everyone, all employees, whether they're participants in the plan or not, where this other notice only goes to participants in the plan. You'll see separately that we do provide a summary plan description wrap document service. And so you'll see how you could very easily generate that and manage your documents online. We also provide a summary of material modification tool. Let me just give you a brief definition of what summary material modification means and what that is. Anytime you have a change in a benefit plan and that change is considered material, meaning the benefit value went up or down, or some major change within the benefits, ERISA requires that you provide a summary of material modification. And then they'll ask for those. By the way, that's another thing they ask for when they do their audits. So they'll ask for a summary of material modifications. We provide you a tool to create those inside this system as well. Before I go in there to show that to you, I wanted to show you a high-level view of what the SPD wrap document service looks like. The only item on here we don't help with on this whole list is the bottom one, which is the summary of benefits and coverage. That you get from your insurance provider. And so you do want to make sure you get those out as well each year. But that's not a service that we provide. The Summary Plan Description Wrap Document Service, or SPD Wrap, is set up to where you go in, you answer simple questions about your company, about each of the benefit plans. It asks all the questions needed to pull in that missing insurance company information we talked about earlier. And then you push a button, it generates your document, emails it to you with instructions on what to include with it. And by the way, when the document arrives, you'll add in a component plan information to it. So you'll see our system doesn't have you put in deductible and co-insurance and limitations. It would be a nightmare if you had to enter in all that information into the system. So what it does is it references to the core document. So you'll attach something like the insurance certificates or a brochure or something that explains the details about each of the plans, whether it's medical, dental, life, disability, etc. And so that, again, that emails you instructions on that. And we'll actually generate a document together here in a moment. So I also wanted to, let's go into that now. I'm going to close this up. We do provide a 125 premium only plan document service, and that's an option that could be included in here. So if I log into the system right now, and let me just pull that over here. So I'm going to log in as a client, and we'll show you what this looks like. So if I go in as a client, you'll see once I log in, a logo will appear in here, and then you have a number of options in this compliance center to help you with all of your compliance areas. So you get all these tools that's here. So we were just talking a moment ago about this all-in-one employee notices. So if I go under employee notice report, I can go in, upload my logo, answer some simple questions about my business, answer questions about my medical insurance. And again, we ask only the questions that are needed to populate the notices that apply. So you'll see something in here, for example, that says, do you have a prescription drug plan? Is your plan creditable or not? Now, most of them are, but there may be some that are not. So you can click this definition to see what does that mean, if it's creditable or not, or you can contact someone like Brian or the insurance provider, and they can help answer some of those kinds of questions. Now, if I come down here, and I have some options now, if I put in the month that my insurance renews, then it'll remind you every year to go in and run your notices again, and then you distribute them out to participants in the plan. So I can come down here, if I've filled out everything, I could click this button to generate my all-in-one notice, and then that pulls in all the notices that we just talked about here a moment ago. Or I could also generate my health exchange notice. Again, we separate them because this goes to everyone. This one only goes to participants in the plan. So I'm going to generate a notice right now. So if I generate that, and now that's the notice is pulled together, it's customized to me, and now that has just sent that to me. So if I go into my email now and I do a refresh screen, let me do that. And so now that just came over for me there right now, and I was able to open that up. So now I can see inside of here, it gives me instructions on what to do with an all-in-one notice. It gives me instructions on how to deliver it, and even reminds me to go into the Center for Medicare Services and register there, which, by the way, is a requirement for you to do each year. So one of the things, before I go in and show you this notice and what it looks like, I do want to mention on the delivery requirements, because the same is true for notices as well as summary plan description wrap documents. Now we're going to provide you a lot more detail about your electronic delivery options as well as non-electronic ones, but I'll just briefly summarize here that you could send those to a work email, you could post it to some sort of an intranet site or some other tool where it posts the documents and stores them, or you can even send it to a personal email. If you use a personal email, you do need to make sure you obtain some sort of written authorization from them in order to do that. Inside this document, it gives you examples of what you could send out to them or that document to obtain that authorization. If you post it to an intranet site, you still have to individually notify them and tell them of how to notify of the notices or the SPD wrap, and then how to go in and use that service. Now, of course, you could do it non-electronically. That's a lot of, some of these documents can be pretty good size. And if you're going to mail it, you should do it in a first-class mail. You can hand deliver it. If you're going to hand deliver it, you want to obtain some sort of a receipt or something to verify from the signature saying that they received it. But again, there's details here on how to handle the non-electronic delivery methods. Most organizations are trying to find ways to do it electronically. Again, just to save all the hassle of making the copies and getting them out to everyone. Okay, with that, let's go into the actual notice that we just generated here. So if I click this notice document now, you'll see in here that this has pulled in all of the notices now. And widen that document here so we can all see it. Okay, so that would be your logo, your company information, and then it pulls in all the notices all in one document. Now, I said I had a grandfathered plan, so that's why it pulled it in. It only pulls in what applies to me. So now there's my HIPAA, here's my CHIPRA, Children's Health, here's my Women's Health and Cancer, my newborns notice, and so on. So I've got all the various notices right here that apply to me all on one. I've got my initial COBRA. I've got my on down to the last one that applies in here. I've got my Medicare Part D notice. And I may have more than one if I've got more than one plan and one has a credible prescription drug plan and the other doesn't. Okay, so it's a nice, easy way to take care of these notices one, and you're done. And you don't have to worry about it the rest of the year. Okay, so let's go back to the web-based tools here for a moment. So there's a number of other things that you have in here. So we also talked about the SPD wrap document. Again, you could create separate SPDs, but this is a really easy way to run that and take care of all your SPDs in one shot is using a wrap document. So inside of here, now I won't hit every single field, but just to show you kind of how this works, anything you filled out in the employee notice section would automatically populate over here, so you don't have to retype in information. And then I go in, I enter in basic information about my company. I indicate which benefit plans that I have. And then whatever I check here is what populates down below. I do have to cover what happens with eligibility. And I can cover, so you can see here, perhaps it's full-time employees who work 30 hours, benefits start the first of the month after 60 days. I could have differences where it says is benefit eligibility start date the same for all benefit plans. Sometimes there's differences. So like I said here, the dental plan starts after 180 days. So there's always a question to add on other. Are there other benefits that are different? Does eligibility differ for any group, such as executives? So I could come in here, like here I says, yeah, executives who work 30 hours, their starts as of the date of hire. Are there other groups? So you've got that kind of capability inside of here. If I want to take something off, I just hit remove and take it out. I also come down here and it asks me for a measurement period. So do I have a defined measurement period? Let me give you a little definition of what that is. So with the healthcare reform, companies are wise and should define a measurement period to determine eligibility for benefits. So the measurement period can be anything from 3 to 12 months. And that time period that you define is where you'll go back and you'll look at all employees who have worked for you over that time period and see who's averaged 30 hours or more. And anyone who's averaged 30 hours or more, they're eligible for benefits. And I leave them on the benefits over the same time period that I had for my measurement period. It has to be at least 6 months. Now, most people are doing a 12-month time period. So, for example, if I go back over the whole past year, I look at who's had average 30 hours, and now I know what my measurement period is. Now, there's an administrative period, and that's the time period they allow for you to do your calculations, to get them the paperwork, to get them signed up on benefits. So they allow a little difference. So you can't be more than 13 months total with a combination of the measurement period and the waiting period for anyone new, any new hires getting on benefits. And you can have different measurement periods for your new hires and for your ongoing employees. Okay, let's go on down. So I cover what happens when benefits terminate. Do they terminate the last day of the month, or do they terminate the last day the person works? I cover my open enrollment time periods. I may have more than one open enrollment. In this particular case here, we show that they did have more than one. I also cover my plan year. And then I go down here and I cover details about each of the benefit plans. So here's my medical plan. So I could go in here and I can add in details on a medical plan, and there's the question, is there another plan? And so you see in here we've made up some fictitious information and added in another medical plan. Is there another plan? So if I have another plan, I can say yes, and then you can see it just keeps adding in the additional plans inside of here. So I do the same for each of the benefits. Now this service allows you an option to include rates if you want. Right now we're not showing any rates for anything, but there's an option further back here where it says I prefer not to show rate contributions inside the SPD wrap. So if I say yes, then I'm not going to see the rates. If I say no, now I do see rates, and I can include the include the rate information for the different benefit plans that are included. So if I going on down now, you can see the different each of the benefit plans, and then I can come down here. If at any point you have questions, you can always call and speak with a specialist to answer any questions and help you through this. So we won't know the content questions, so if you have a question about any of the things you're asking for here, you may have to get hold of the provider or Brian or his organization. So anyway, that's a quick overview. If you have any questions about anything we're going through here so far, please feel free you can send me over a question. So now if I go back here to some of the other things that's available, we also talked about a summary of material modification. We provide you with a summary of material modification tool to where anytime you have a change in a benefit, it's very easy to generate that summary of material modification. So let's say, for example, I had a change in my medical plan. I could check that box. I can indicate what I have to now describe the change. So I could either attach something that explains it, probably what I'll do in most cases. If it's relatively simple, I could check this and actually explain the change. So I have that option there. And then I'll indicate the date that the change occurs, and then what kind of a modification was it? Did provisions establish new benefits, changes that eliminated benefits, or one of these other options? Once I'm complete with that, I can generate that, or if I want to do more than one, maybe there's multiple main changes that have taken place here that I want to explain, and then I could go into that. But if I'm ready to generate it, I just click this button to generate it, and then it saves and stores, it'll pop up here for me to download. This one doesn't email it to you, it just pops up for you to download it and immediately deal with it. It also saves it in the summary of material modification history. So I didn't run one here now, but let me open up the history and I'll just show you what one of these look like. So if I click this download, and this is how it'll pop up for you to be able to download and open it up that way. So I've clicked this now, I've opened this up. Here's my summary of material modification. It's addressed to participants and beneficiaries. I can scroll on down. It was my medical plan. The reason for the change is provisions that establish new benefits on this date. And then I see here where it says I see attached to explain the changes. Now as I go down here, I've got the contact information. Everything's populated. It connects them to the SPD wrap document. Now I've got a formal document I can give to participants, and I can also save to give to the auditor when the audits come around. So they're all saved in here, but it's another thing they ask for, but it saves all the past summary material modifications right here inside the tool. Now, if I have a 125 premium only plan document service through us, same thing there. I can click, go in here. I can very easily enter in some basic company information, and then I've got that service there as well. If I go in here under legal updates, I can see all the past legal updates if I want to search by month, or I could just search by topics. If I'm looking for information on a legal topic, I can search inside of there. So you've got this legal library as well. There's a section here for forms and documents. We're actually going to be expanding this, adding in a lot more documents and services inside of here. Right now, it's mostly basic information, new hire type things, but we're going to be expanding and adding other things inside of there very soon. There's a tool over here where you can get access to all of our past best practice articles and bulletins. So I mentioned we did one on the employer reporting requirements. If I click this link, you can actually see the article right inside of here. There's also, once a year, we provide you with a compliance calendar. So I've got an example of the calendar right here. We send this to you in December, and it lays out for you the entire year, showing you the date, what's the compliance issue, and then what do you need to do. So for example, in February, there's a OSHA posting requirement. So if you come down here, you see that OSHA posting requirement. Then you'll also see we notify you in the legal alert that goes out that will tell you, remind you in January that you've got that OSHA posting requirement and what you need to do from there. So again, we try and make this very easy for you to do and go through that whole process. So coming back here, now we've hit most of these areas. The last one I'd like to go through is this HIPAA kit. And so if I go into this HIPAA toolkit, you'll see here I can click here first to determine what level of HIPAA applies to me. Here's some steps to complete a HIPAA program. And then inside of here, we have all the forms, documents, templates, policies, everything you need. So you can set your policy in place. You have everything here to implement it. Most of you won't need everything in here, but you'll likely need a business associate agreement to have anyone sign who perhaps works with the protected health information at your organization, or outside. Mainly it's for those who work with you from an outside organization. Okay, so this is a quick overview of the web-based tools that are inside of here that's part of this compliance basic service. Let me walk back. I'm going to go back now to and walk you through some of the rates on how this is set up here. So if someone's interested in everything we've talked about here, the full compliance basics plus SPD wrap and 125 POP service, you can get the service for an annual investment of $265. Now you can look for other options on the internet. You'll see the costs are a lot more expensive than this, especially when you consider everything that you get for this. If you don't need a POP document, bearing in mind that if it's older than last year, they're probably out of date. But if you don't need that, then you can get the Compliance Basics plus SPD wrap for $218 a year. Now the reason I show on here that you can get it for lower than the normal cost, and this is because of your relationship with Brian and his organization. So let me show you how you can sign up right online if this looks like something that you're interested in. So if I go back to the our main site, I'm gonna log out of here for a moment. So if I logged into hrserviceinc.com, and this is where you would go, is just hrserviceinc.com, and I went up here to Get Started Now, and I click the Get Started Now. If I come down here, you select which service option you want. So if I wanted the Compliance Basics plus SPD wrap and POP, it shows here $279. So as I click that and then I say Next, then I'll put in a username and password that I want to log back in to use the web-based tools with. And then it has a place here for your partner key. And Brian, I may need to have you come on here just to remind me, but I believe it's 1364. I'm pulling that from memory. If you could verify that. Is that correct? Okay, thank you, Brian.
1364.
Okay, so if you put in, so Brian's partner key is 1364. So by putting that in, you'll get another 5% off of everything that you do inside of here. I know it's not a huge discount, but every little bit helps, right? So if you put that in, then that'll help you get that discount. There's no other promotional code. So if I put in my password and that code and then I hit Next, you'll see it asks you for some basic information then about your company, and then you would just pay with a credit card. So that's an easy way to do everything online. If you prefer not to do an online sign-up, we can do something differently where we set you up with an invoice, but then you wouldn't get the 5% off. But that again, that's up to you. Okay, so so if we go back now to what we've gone through with you, we talked about the various compliance basics components where you get the 2 web-based or the 2 emails that are sent to you each month: the legal alerts, due date reminders, and then the best practice training bulletin. And then we talked about the web-based solutions where you've got the employee notification service, the HIPAA toolkit, the forms and documents, the libraries for the HR bulletins and the legal updates. We went through the SPD wrap service that's available. We also talked briefly about the 125 premium only plan document. What other questions, if anyone has any questions for me about anything that we've gone through here today so far, please feel free to ask that. Again, you can type over the questions. You can contact me as well if you have any questions. Apparently, I'm just trying to see if I have my contact information. Let me just, I'm going to insert that in here for you right now. So if you want to contact me, my email is ken@hrserviceinc.com. My phone number is 801-685-8400, and I'm extension 6. So feel free to call me if I haven't answered your question today. And then, as I've mentioned before, to go into the service, you just go to our website at hrserviceinc.com. Great. It doesn't look like we have any questions. So, Brian, I wanted to turn it back over to you and see if you had any other final comments or anything for us here today. And thank you, everyone, so much for your time.
Ken, thank you very much. As everybody can see, the complexity of trying to maintain all the Department of Labor employee notices and SPD wraps and Section 125 documents and exchange notices is just pretty overwhelming. We did an exhaustive research and review of a lot of services out there, and Ken's service by far was the most comprehensive at a very, very affordable rate. And we highly recommend Ken's services. We use it at our office to keep us on track on everything that we need to provide. And I strongly encourage everybody to seriously consider it. It's a minor investment to circumvent any potentially huge DOL fines or via audit infractions. Ken, thanks very much. Again, you've done a wonderful job explaining your services and the pitfalls in not being ERISA compliant. And we will continue our relationship, and I really do appreciate it.
Great. Hey, thanks, everyone. We appreciate your time today, and we look forward to helping you with your compliance or other HR needs. Have a great afternoon.